Hi, my name is Jennifer Ruiz. I'm going to be performing a comprehensive head-to-toe assessment on my beautiful assistant, Suzanne. Hi, Suzanne. I'm Jennifer. I'll be your nurse today.
Okay.
I'm going to be checking you from head to toe.
Okay.
Come over here and sit down on the bed for me.
Sure. No problem.
So, Suzanne, how was traffic coming in today?
Well, it was pretty good on the interstate, but it was a little bit crowded coming down to your office.
I'm so sorry. I'm glad you got here. I'm glad you're here to help me with this. Okay, so I noticed when Suzanne walked in, her gait was nice and even and smooth. Her appearance is well groomed. Her skin is usual for her ethnicity. Okay, so I'm going to go ahead and start with your head. I'm going to palpate your forehead. Brachial bones, occipital bones, mastoid. Everything is nice and symmetrical and even. No masses or protrusions were noted. I also checked her hair. It was nice and clean and no pest inhabitants were noted. I'm going to go ahead and start with your eyes. Okay, thank you. I'm going to check her frontal sinuses. Is that tender, Suzanne?
No.
Okay, so no tenderness noticed on the frontal sinuses. Is that tender, Suzanne?
No.
And neither on the maxillary sinuses. Okay, so next I'm going to check her eyes. Look up for me, Suzanne. Okay, eyes are nice and moist. Eyelids are pink. No abnormalities are noted with her eyes. Sclera is nice and clear. And china white. Cornea is no opacities noted. Okay, so moving from her eyes to her nose, I noticed that it's nice and symmetrical and midline. No lesions noted, no abnormalities of the nose. Inside, looking in, I don't see any foreign objects obstructing her breathing. I'm going to go ahead and grab my light and look inside. It's nice and pink and no polyps are noted. Looks like she's breathing just fine. I'm going to go ahead and check for deviation of her septum. I'm going to ask you to hold your nostril and breathe in or sniff. Okay, so the other side. And she sniffed just fine. So no deviation of her septum was noted. Okay, I'm going to move from her nose to her mouth. And go ahead and open your mouth for me, Suzanne. Okay, so mouth is nice and pink and moist, and her teeth look great. She doesn't have any abnormalities of her teeth or her gums. No gingival lining is noted. Her tongue is nice and pink and looks great. Can you move your tongue up and down for me, Suzanne, and side to side? So tongue movement is nice and symmetrical. The underneath of her tongue, the veins are present, and it's nice and moist and saliva is present. Her palate is white and rough on the front and on the back. Can you say ah for me? The uvula and the palate move upward. Also, her tonsils are nice and equal and they're visible, so I would grade them as 1+. Okay. Since I'm at Suzanne's ears, I'm going to check for symmetry. Nice and symmetrical bilaterally, no abnormalities noted, no thickening, no discharge, no reddening. I'm going to go ahead and take a look inside. No obstructions are noted. It's nice and pink. The tympanic membrane is it's a grayish color. Looks nice and normal, and no abnormalities are noted. No perforations. Ears look good. Also, since I'm using my instruments, I'm going to check Suzanne for her red reflex of her eyes. And I'm going to get you to look at that picture over there. And as I move forward, I notice that her pupils fill with redness. Means her red reflex is intact. Okay, so I'm also going to get you to do, it's called the cover and uncover test. Okay. Go ahead and take this in your hand. I want you to look at that picture. Okay. Go ahead and move the paper in, and she has a fixed gaze. Okay, can you do it on your other side? Look at the picture still. Good job. Gaze remains fixed. Okay, so I'm also gonna check for your cranial nerve 8. Make sure you can track my finger. Okay, so up, middle, and down, up, middle, and down. She was able to track my finger. Cranial nerve 8 is intact. Okay, so now I'm gonna check her neck, moving down. Neck is nice and even and symmetrical. No tracheal deviation is present. And since I'm on her neck, I'm gonna go ahead and palpate for her lymph nodes. Working my way down. Is any of that tender, Suzanne?
No.
Okay,
Not at
so
all.
no tenderness noted, no enlargement, and they really aren't palpable, so everything looks good. Okay, so I'm gonna go ahead and move from Suzanne's neck. I'm gonna go ahead and go to her shoulders. Can you shrug your shoulders for me? She does that nice and even and smooth. Can you resist? Good job. Okay. So next, I'm gonna check upper extremities.
Okay.
They're nice and even. Hair distribution is even and smooth. Her skin is nice and dry and warm. Just looking at her skin, I noticed that her turgor is elastic and rebounds as soon as I let go. Capillary refill is less than 3 seconds on each hand. Okay. With your upper extremities, we're gonna do some range of motion.
Okay.
Okay. So can you go up for me, go over, go down, and then out again. Okay, and can you resist? Muscle strength is intact, because she is able to resist. Can you grab my palms? Squeeze them. Muscle strength is nice and even. Strength is intact. And since I'm on her arms, I'm going to go ahead and check her radial pulses. They're nice and regular. I would rate them a 2+. Okay. So I'm going to move to your back, Suzanne.
Okay.
Okay. So looking at Suzanne's back, I see it's nice and even. No abnormalities are present. Suzanne, go ahead and take a nice deep breath in and out. Chest expansion is nice and even and symmetrical. I'm going to go ahead and check for tactile firmness. Suzanne, each time I place my hand on a new place on your back, please say 99.
Okay.
Go ahead.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, so Suzanne's tactile firmness is vibrations are nice and even. I'm going to go ahead and percuss her lung fields. Percussion is nice and hollow. No abnormalities were noted with percussion. Okay, Suzanne, can you go ahead and turn around for me? Okay. So I'm going to go ahead and teach you a self-breast exam.
Okay.
And you can go ahead and lay down for me.
Sure.
Okay. So I've got you this nice patient education. You can hang it up in your shower.
Okay.
You can do this either standing up in the shower or you can do it lay down in your bed.
Okay.
You're going to go ahead and lift your arm up. And with your opposite hand, you're going to go ahead and palpate around your breast and feel if there's any lumps or anything different than what's normal. You feel any tenderness or masses, or you can go ahead and work your way up into your underarm. Okay, so you do that every month.
All right.
You can knock one of these off every time you do it.
Okay. Good.
Okay.
Thank you.
All right, so since Suzanne's laying down already, I'm going to go ahead and check her abdomen.
Okay.
Okay, so since she's laying down, I'm going to go ahead and auscultate her stomach before I start messing with it and check all 4 quadrants. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant, and vowel sounds were present in each quadrant. Okay. So now I'm going to go ahead and do some palpation of Suzanne's stomach. And you tell me if any of this is tender, okay?
Okay.
So I'm going to start with light palpation. Suzanne's not saying anything, so I don't think there's any tenderness present. So I'm going to go ahead and do some deep palpation, and you tell me if there's any tenderness present there.
No.
Okay.
No.
Good job, Suzanne.
Yeah.
Okay. So since she's, I'm done with that, I'm going to go ahead and get her to sit up again, and we're going to auscultate your lungs.
Okay.
And your heart.
Okay.
I'm going to start with Suzanne's lungs in the back. Nice, deep, even breaths. Okay, so Suzanne didn't have any abnormal or adventitious lung sounds. So I'm going to go ahead and check her heart. I would also check her lungs on the front. I'm going to go ahead and check her heart now.
Okay.
I'm going to start at the aortic. Move my way up to the pulmonic. Go to the 5th intercostal midclavicular line to hear the mitral and the tricuspid. And since I'm already osculating, I'm going to go ahead and check if there's any abnormal sounds of her neck.
Okay.
So no bruits were present upon osculation. Oh, and I'm also going to listen to her her heart sounds with the other side of the stethoscope. Start at the aortic, move my way to the pulmonic, down to the mitral, and the tricuspid. Okay, so heart was regular. Everything sounds good. No abnormal heart sounds. Okay. No murmurs, no abnormalities at all.
Okay.
I heard S1 and S2 upon oscillation also. Okay. So, gonna go ahead and check Suzanne's lower extremities. Since she's already laying down, I would go ahead and I would check her femoral pulses and her inguinal nodes if we're doing this really. And then I would check her popliteal pulses, her posterior tibial pulses, and her dorsalis pedis pulses. So they're nice and even and regular and plus and 2+. Okay. You ready to stand up, Suzanne?
Sure.
Okay, so we're gonna do some neurological testing. Yes, reflexes first. Okay, so I'm gonna go ahead and check Suzanne's her bicep, deep tendon reflex, and her bicep was nice in contraction. The tricep contracts nicely, and the radiobrachial contracts nicely also. So I'm gonna move my way down into the deep tendon reflexes. And I notice that they're nice in contraction. And the Achilles deep tendon reflex is also present in the calf. Okay, so you're gonna go ahead and stand up for me. And since she's standing up, I'm gonna go ahead and I'm gonna start with her hip range of motion by asking her to bend over. You notice any pain when you did that?
No.
Okay, good job, Susan. And I noticed when she did that, her spine stayed nice and straight and symmetrical. Okay, can you also do some rotation of your hips for me? Okay, any pain noted when you do that?
No.
Okay. We're gonna work our way down to your lower extremities, to your knees. Can you go ahead and do a squat for me? Bring your both knees up for me. Did you have any pain doing that?
Not at all.
Okay, good. And what about your feet?
Okay.
Can you do some range of motion?
Mm-hmm.
Go up, down, and around. Did you have any pain doing that?
Not at all.
Awesome. Okay. Can you do it with your other foot?
Absolutely.
Nice and smooth and even bilaterally. Range of motion is nice. Okay. So next we're gonna do some neurological testing.
Okay.
Okay. We'll start with clonus. I'm gonna check your clonus and I'm gonna push your foot down. And since her foot did not go back up, she is negative for clonus. Also negative for Babinski's. Okay. Go ahead and stand up for me, Suzanne. So now we're gonna do the heel to toe test.
Okay.
Go ahead and walk in a straight line with your heel to your toe. Suzanne's coordination is nice and smooth and balanced. Okay, and so we're going to do the Romberg test next. Go ahead and stand with your hands. Close your eyes. Suzanne's not falling over, so Romberg is negative. She would actually do that for 20 seconds.
Okay.
Okay, and then can you do your finger to your nose? Good job, Suzanne. So no neurological abnormalities are present. And finger to finger.
Okay.
Okay, so Suzanne does all that very well. We're also going to test her for Fallon. Go ahead and squeeze your hand. Open your hand back up. Palm is nice and white, and it refills with pink. Okay, cool. I think that's it. Oh, and your heel to shin test.
Okay.
Go ahead and rub your heel and go up and down your shin of your opposite leg. Suzanne is able to do that nice and even and smooth. No neurological abnormalities are noted in her heel to shin test. I think that's it. Thank you, Suzanne, for your help. Okay.